हमने फर्स्ट एड सीपीआर का प्रोग्राम बनाया है जो टेलरमेड प्रोग्राम है। ये प्रोग्राम में हम लोग 3 पार्ट्स में हम लोग को जो है ट्रैफिक पुलिस को ट्रेनिंग दे रहे हैं। नंबर 1 इज अ फर्स्ट एड, नंबर 2 इज अ सीपीआर, नंबर 3 हाउ टू हैंडल द मेडिकल इमरजेंसीज। तो उसमें कोई भी पेशेंट और कोई भी बंदा अगर अनकॉन्शियस होता है बिकॉज ऑफ एनी रीजन और ही इज नॉट ब्रीदिंग, सो हाउ टू इनिशिएट अ सीपीआर, हाउ टू रिस्टार्ट हिज हार्ट, दैट इज व्हाट वी आर फोकसिंग ऑन बिकॉज वी नो दैट CPR is very, very important at that point of time where you just have few minutes that you can save a life. And I would like to begin with the fact that everyone can do it. It is not, we can be dependent on doctors or nurses or a hospital to save a life in that particular scenario or a situation. Every citizen can save a life. It is very simple. If you find someone unconscious and is not breathing, the only thing that you are supposed to do is keep pressing his heart in the center of the chest. That's it. Keep pressing it 2 times in 1 second till the time you reach the hospital or any ambulance or the doctor arrives. That is the only idea how we can save a life. And we could have saved many of the people, like unfortunately we lost APJ Abdul Kalam sir, or we lost singer KK, because people are not aware of this kind of things and how to save a life. Apart from that, we also train the police people on how to handle the accidental emergencies, how to control a bleeding, how to immobilize the cervical spine, how to manage the head injuries, or even shifting the patient on the stretcher. That is very important because a lot of people don't know how to shift the patient into the ambulance. People just hang the hands and the legs and they try to put it on a stretcher. This is not a right way of doing it, and that is the secondary injuries that what exactly the patients are getting. So very important, controlling the bleeding, providing the CPR, but also important how to mobilize the patient into the ambulance. That's very, very important. That is also we are training the Delhi Traffic Police so that at least they can support the ambulance personnel while shifting the patient on the stretcher itself. And that is very, very important key point while you shift the patient to the hospital. So,
Doctor, if you can show a little bit of how the CPR is done, I think it will be helpful for everyone.
So, if somebody is unconscious and is not breathing, just what we are supposed to do is just unconscious and not breathing. Just what we are supposed to do, we just need to identify the center of the chest. It is just above the line where the bony part ends and 2.5 inches above. Just put your hands and keep pressing it 5 to 6 centimeters 2 times in 1 second. That's it. It is as simple as that, and everyone can do it.
Maybe we can get sir to do it. Dr. Suresh, yeah, please.
So just the center of the chest, you need to just keep pressing, just lock like this. Yeah, and just keep it pressed like this. That's it. Is as simple. You don't have to go to to learn the things and do the courses, etc. But it is, yes, it is continuous 2 times in 1 second. You keep doing it till the time you reach the hospital.
And it's very important that the person is not breathing,
Yeah.
then only you do it. A lot of people do it when people are breathing also.
So there are a lot of videos what we see that people are breathing, they are moving, and still people keep pressing on the heart, which is a wrong message conveyed. So just like this, keep pressing it. It is as simple, easiest way. Within a minute, I could make them understand that how to do it. And if you find any unconscious patient who is not breathing, this is the only way that how you can save a life.
Yes.
Just keep pressing it.
So like this, and then
2 times in 1 second, you're done. You at least keep the patient alive till the time you reach the hospital. Any questions?
CPR might save life,
Absolutely.
but could you might?
Yes.
Because it is not a must.
yeah,
You should make it clear.
yeah.
So,
It is,
can
sir.
you tell me out of 100 CPR we do, how many lives approximately can be saved?
So statistic is 40% survival rate if you provide pre-hospital CPR. But if you don't do it, 100% death is confirmed.
Great.
Because it is just a few minutes that you are away.
I have a question, like if it's not an adult and if it's a child or something, so it's kind of a same pressure that you put on the.
Absolutely, it is same. You might require a lesser amount of pressure because the child chest is very small, a delicate one, but still there is no change in the logic. 2 times in 1 second, that is the simplest way how the common man can understand. 2 times in 1 second, keep doing it non-stop till you reach the hospital or somebody else takes over it.
You talked about APJ Abdul Kalam could not be saved because people there around, nobody
Nobody knows because see nowadays also people are not aware. Somebody collapsed, what to do? people do lot of things. They keep, making smell the patient with the socks or a chappal or like that. Lot of things they do. They try to give him a water also to drink. Make videos, and they do lot of, unusual things, But nobody knows what to do in that situation. See, the logic is only unconscious, no breathing, start CPR. That's it. 6 months back, we saved one life of a 65 years old man. We have trained a Zomato rider who is a delivery partner of Zomato. They were trained on providing CPR in the first aid. He was just on the way for his delivery, and he just came across a case wherein somebody was unconscious at the roadside, and he just intervened he just saw the crowd, what happened and all that. And then he realized that the person was unconscious, he's not breathing, he started a CPR, and he shifted the patient to the hospital, and we saved a life. So that's the reality. It's important that how we understand that what is the scenario, what is the situation.
I also want to tell you a small example of a thing which happened in my building. There was a gardener and he collapsed, and उसके मुंह से झाग निकल रहा था, and everybody just got cold feet. So I immediately called our call center and I said ये हो रहा है, मैं क्या करूँ? तो उसने कहा उसको साइड में रखो आप पहले, क्योंकि वो झाग अंदर नहीं जाना चाहिए. और वो उसको बाय देन वो अनियन और चप्पल पता नहीं क्या क्या सुंघा रहे थे, तो वो सब हमने रोका और तुरंत एम्बुलेंस को बुलाया और उसको हॉस्पिटल में पहुंचाया. सो आई एम जस्ट सेइंग, कभी कभी क्या होता है, जब नहीं मालूम होता हम गलत चीज कर देते हैं और वो केस को और खराब कर देते हैं.
ये झाग वाली सिचुएशन में देना चाहिए CPR की नहीं देना चाहिए?
नहीं, झाग वाली में जब ब्रीथ कर रहा है तो नहीं देना चाहिए. सबसे इम्पोर्टेंट है CPR तभी देना चाहिए जब बंदा ब्रीथ नहीं कर रहा हो. तो झाग वाली सिचुएशन में ब्रीदिंग तो हो ही नहीं थी.
डेथ कह सकते हैं.
करेक्ट.
It's a pre-death. You can't say it's a death. It's a
So,
pre-death.
I
Just
think-
before a
जब
death.
हार्ट काम नहीं कर रहा हो, basically.
हार्ट काम नहीं कर रहा हूँ.
अब हम सर अब निकलेंगे, तो अगर और क्वेश्चंस हैं हम पूछ सकते हैं. और अब हम सब बाहर जाएंगे डेमो के लिए अपनी 5G एम्बुलेंस के लिए. सर हम चाहेंगे कि आपको भी हम दिखाएं. और
एक सवाल.
यस सर.
Sounds from the heart and lung sound, and of course from the pregnant woman we can get the sound of the baby, so that if it's some kind of trauma and you want to know whether the baby is alive or not, you can get that information as well. And along with it, you are seeing the patient on real time. Along with it, we can have a two-way communication, and you can add multiple doctors together. So there are instances where you have a critical patient who might need intervention of multiple doctors at the same time. So multidisciplinary approach can also be done. And you are seeing the data of the ventilator, syringe pumps. These are sensitive drugs that are life-saving. So inside the ambulance, the things that we do are include giving injections which are life-saving. So sensitive drugs has to be given in a very calculated manner, and that has been shared here. We can manipulate it, we can change it, and in the remote setup itself we can treat them and save their lives. So that's what this is about. And of course we have MRI and prescription, whatever that's added, that comes into the screen as well.
Done, right? हाँ.
सर अंदर आइए.
अरे अंदर नहीं बुलाइए मुझे.
सर आप फोटो निकालने के लिए आइए सर.
मैं कभी
मैं अंदर नहीं, फोटो निकालने के लिए बुला रहा हूँ सर.
अंदर मत बुलाइए. अभी एक लड़की थी, उसने कहा ऊपर आइए. इसी समय से डरा हुआ हूँ.